Hi, good afternoon and welcome everyone to Santé Group's next instalment of our Lunch and Learn session. Today I'm joined by Perci Health, and as part of Cancer Prevention Week, we're hosting a live session with Rachel Rawson, lead cancer nurse specialist, and Ruth Hutchinson, strategic partnership over at Perci, to explore practical ways and steps that we can all take to lower our risk of cancer. So I will leave the introduction there from myself and hand over to both Rachel and Ruth to make some instructions.
Thanks so much, Jenna. I'll start, I think, Ruth. My name's Rachel, and I'm one of the lead cancer nurses at Perci Health. I've been a cancer nurse for many, many years, over 30 years, and worked in the NHS, worked in cancer genetics, worked in the charity sector, and now I work in the digital side of cancer nursing, which is something very different and new and exciting. I'm going to pass you over to Ruth in a moment, and then we will be swapping backwards and forwards whilst we go through the slides and doing the session. Ruth.
Wonderful. Thank you, Rachel. Pleasure to be here. So I'm Ruth Hutchinson. I've been working in the health and wellbeing space for over 20 years. It seems like a long time. And like many people, my life has been touched by cancer. So I'm delighted to be supporting Perci to extend their services to as many people as possible via strategic partnerships. I'm also a wellbeing consultant and career coach. So if you'd like to pull up the slides, I'll just talk through a little bit about what we're going to be covering in today's session. So if you just flip to the next slide, if that's okay, Rachel. Fabulous. Okay, so we're going to kick off with a quick introduction to who we are and how we support people. I'm then going to hand over to Rachel, who will be leading on today's topic, which is understanding cancer risk. And Rachel's also going to be sharing some practical tips on things that we can all do to really help reduce our risk of getting cancer. We're going to finish up with a Q&A, so please do share anything that's on your mind. There is no such thing as a silly question, so we welcome any questions that you have at the end of the session. So who are we? So we are Perci Health. We are the UK's largest virtual cancer clinic, and really we exist to support people at every single stage of the cancer journey. So that includes prevention, diagnosis, treatment and recovery. We were founded in partnership with over 30 of the UK's leading oncologists, and we now have more than 85 cancer specialists that are actually delivering care. We have specialists such as dietitians, physiotherapists, psychologists, cancer nurses, all of whom are on hand to support as part of the Perci ecosystem. Recently, and we're delighted to share that we've entered a formal partnership with Macmillan Cancer Support, who are the UK's largest cancer charity, which really speaks to the clinical trust and credibility that we've really worked very hard to build at Perci. So why did we build Perci? To be honest, the answer is simple. Because cancer is impacting more and more people than ever before. I think around 1,000 people are being diagnosed with cancer every single day in the UK, which is over a third of those are of working age. So that's around 360 people each day trying to navigate cancer alongside their life and their work. But it's not just the ones that are diagnosed. There are many people that are supporting loved ones, people that are worried about symptoms, or supporting colleagues. So we really created Perci to support everyone who is impacted by cancer. So how do we do that? So we deliver care in 4 key ways. The first is our multidisciplinary virtual clinic, where members can access tailored support from over 20 types of cancer specialists. The second is our digital platform that offers clinically validated risk assessments, personalised content and on-demand nurse chat. We also understand the importance of supporting organisations, so we also provide manager training and practical resources that can help managers navigate cancer in the workplace. And then finally, we run regular education sessions like this one, really to help people understand cancer and know how to take action. So with that, I'm going to turn over to Rachel, who's going to lead on today's topic. Thank you, Rachel.
Thanks, Ruth. So what we know is that the population of people living with cancer is rapidly growing, and that's for several different reasons. The population is aging. We know that. We know, as Ruth has said, that 1 in 2 people will be diagnosed with cancer in their lifetimes, and their lifetime risk doesn't really come true generally until you're in your older age, so over 80. However, we do know that some people, more younger people, are being diagnosed with cancer much earlier. And we also know, which is the good news, that many, many more people are living after a diagnosis of cancer. And this is because of new treatments and more incredible ways of caring and supporting people after that diagnosis. But, and there is a big but, there are large gaps in the care at every single stage. When we think about prevention, and this is what we're going to be talking a bit about today, prevention, and I'm going to touch a bit on screening. About 40% of cancers are preventable through lifestyle modification, and this is a really shocking fact. And I'm going to go into all of those and hopefully give you essentially some information, advice and top tips on how to bring those into your daily life. And the other area is screening, where about 35% of people are not taking up their screening appointments. So that's a huge amount of people that are missing out on their mammogram x-rays or their cervical screening, and more recently on bowel screening. And we know that in this country, in the UK, about 41% of people are diagnosed at a late stage. And what screening is there for is to find cancer at that early stage where it's easier to treat and hopefully has a better outcome. And finally, treatment. 32% of people are waiting more than 2 months after an urgent referral to get all their investigations, checks, and start treatment of some kind or another. And this brings us to 15 years behind other developed countries. So this is essentially the problem that we're dealing with. So what is our solution? So twofold. Firstly, to prevent cancers that are preventable. And secondly, to ensure that when diagnosis happens and when treatment is ongoing, and when a person comes to the end of that treatment, that they can navigate their way through it, but also recover afterwards to live and live well. So what does cancer risk really mean? This is about the likelihood of developing cancer at some point in a person's life. Now, there are many things that influence this, some of which we can't change. And you will probably be aware of family history, particularly around genetics and breast cancer, and the genes BRCA1 and BRCA2, which when altered can predispose to breast cancer happening at an earlier age. And what we know is that about 5 to 10% of all breast cancers are related to genetics. And there are other forms of cancer, like prostate and colon cancer, that can also be related to genetics. And genetics we can't change. We inherit our genes from down the male line or the female line. Biological factors, so age, so we get older, as I said, 1 in 2 people. Lifetime risk of cancer of some type. So our cells age, our DNA changes. And this is why when you're looking at particularly something like breast cancer, you'll find that about 80% of women will be diagnosed over the age of 50, which is why we have the National Breast Screening Programme. And in terms of gender, the most common cancer in the UK is breast cancer, and about 57,000 women are diagnosed every year. And we mustn't forget that men can also develop breast cancer, and probably about 390 men are diagnosed every year. And then we have environmental factors, so otherwise known as carcinogens, such as radiation and chemicals, etc. Now, we can't change many of those factors that I've just mentioned, but we can influence lifestyle choices. And this is what I'm going to focus on in the next few slides. And as I mentioned before, screening programs are there to detect abnormalities very often before cancer develops, and very often when cancer's at an early stage, so that treatment can be much more effective and successful. So thinking about how we reduce the risk, weight and obesity is one of the biggest things that impacts our health. So being overweight can increase the risk of at least 13 different types of cancers. And this is particularly so when we're thinking about postmenopausal breast cancer. So breast cancer, when your periods have stopped and you're in the menopause. And what happens at that time is whilst your ovaries stop working, your body fat still continues to produce a level of estrogen. And that can then cause inflammation and increase levels of certain hormones in the body, which can lead to breast and bowel cancer. Obviously, not everybody who's overweight will develop cancer, but it definitely does increase the risk. And when we think about 60% of UK adults are classified as being overweight in the UK, we can see what a huge problem it is. And it's not just about cancer, it's also about diabetes and heart disease. So obesity is estimated to cause around 18,000 cancer cases annually, which is a really huge number. And it's the second biggest preventable cause of cancer after smoking. So whilst we often think about smoking and cancer, we sometimes forget that weight and obesity can be just as important and controlling that. And I'll talk about some ways shortly to help. Red meat. I mean, many people know that red meat can be harmful, particularly when we're thinking about bowel cancer. And it's to do with the compound called heme, which makes the meat red. And it can damage the lining of the bowel. We hear about looking after our microbiome and keeping our gut health in tip-top order. And in order to do that, we need to reduce the amount of red meat that we eat. Chicken, absolutely fine. White meats, absolutely fine. But if you're going to be eating red meat, try to reduce it probably to once or twice a week. And remember that processed meats, so things like bacon, sausages, hams, they have preservatives in them called nitrates, and they also can increase the risk of bowel cancer. So again, enjoy them occasionally and in moderation, but try not to make them a large part of your diet. Moving on to ultra-processed foods. So ultra-processed foods and foods high in sugar, salt and fat. I think many of you will know that these are probably not the healthiest things to have. And we find them in ready meals, we find them in packaged bread, we find them in some meat alternatives as well, which can be quite confusing if you're thinking that you're eating a vegetarian diet or a vegan diet. So just to be aware of that. And there's the high fat, high salt, high sugar foods like crisps and sweets, etc. And these are very, very high in calories. And as a result, they help you to increase your weight. And by doing that, you increase your risk of cancer. So we often hear that sugar is a cause of cancer, but actually it's not the sugar itself. It's the fact that by eating the sugar, you're increasing the weight. Lots and lots of good evidence around physical activity and the protection that this can give you. And that's moderate physical activity. Brisk walking is an amazing thing. You don't have to be going to the gym to achieve your exercise. Brisk walking is excellent for the long bones, particularly for women, to protect against osteoporosis, but it's been proven to protect both reduce the risk of cancer developing, but also, if you've had a diagnosis of cancer, to reduce the risk of the cancer coming back as well. And again, it's very protective in the postmenopausal phase and for womb cancer, so cancer of the lining of the womb, and bowel cancer. I mean, we all probably know that we are advised to exercise about 150 minutes a week, and just finding ways so that you can build that into your day, even if it's 10 minutes 3 times a day, that will soon build up to your 150 minutes a week. But any exercise at all, as the World Cancer Research Fund quote states, just keeping your body moving. And remember that non-exercise activity can be equally as important. So when you're doing the housework, when you're doing the garden, when you're running after the children, that all adds up. Alcohol and smoking. As I said before, we're very, very aware that smoking is very impactful in terms of cancer. About 15% of all cancers in the UK are caused by smoking. And cancer risk is significantly higher for those who drink and smoke, with the two activities together. What might be surprising is how much impact alcohol has on our DNA, and how much it can change our DNA, and how much it can influence the development of cancer. And around 8 in 100 breast cancers are linked to alcohol. And this, you might think, oh, if I was to drink a lower alcohol drink, that might be more protective. But actually, there is no safe amount of alcohol in terms of percentage or in terms of type that is protective. So the government recommendations are no more than 14 units for men or women a week. However, if you can cut down to a much safer level than that, or even cut out alcohol at all, it will dramatically reduce your risk of several cancers, particularly breast, bowel, liver, mouth, throat, and stomach. As I've said, we all know the risks of cigarettes and the harmful chemicals that they contain, and both alcohol and smoking affect our DNA. And as that builds up, as that changes, that DNA can't replicate in the same way that it did before in the ordered way, and it becomes disordered, and that's where cancer can develop. We've been having some great weather. Well, I hope you have been anyway. And the sun and UV rays, really, really important to protect your skin. And I'll talk a bit about that in a moment. But again, not protecting your skin allows UVA and UVB to penetrate, and particularly the UVA deeply penetrates. And this is in relation to melanomas, so melanoma skin cancers, which is a very serious type of skin cancer. We really need to stay out of the sun in between 11 and 3, use sun factors, and never use sunbeds, because all of this can increase our risks of skin changes and potentially melanoma. More young people are being diagnosed with melanoma. So sun protection, incredibly important, and also making sure that you're checking your body for moles, any new moles, and letting your GP know if you notice anything different or new is always important. So how do we fit cancer prevention into our busy working lives? It's not easy, and particularly since the pandemic, as we've been working at home much more, and we may be only walking up and down the stairs, or even just around one floor, but trying to get out before work. If you are going to work, making sure that you're building a walk into the work. trying to go out at lunchtime and trying to have some kind of exercise after work will all help in terms of exercise. Eating healthily, planning meals, having healthy snacks, so not reaching for the crisps and the chocolate, but having things like crackers or nuts, making sure that we limit alcohol and alternate with water, ensuring that we drink lots of water throughout the day, using some protection. I talked a bit about that already, but we really need to be using a factor above 30, preferably 50, putting it on 20 minutes to half an hour before we go out in the sun and replacing it every 2 hours. You do need to use a lot of sun cream to get that full protection from it. And if you are smoking and you want to stop, which obviously it's something that we would recommend, then do seek out what's available in the workplace in order to support that. And as I've said, stay active at work and know what your employee benefits are and how you can access them, because they can all bring help for you to build in strategies to your busy working lives so that you can take some of these things on and reduce your risk, do something really active to reduce your risk of cancer. I get asked a lot about cancer myths, and it might be something that you want to pick up, because there's hundreds of myths around cancer, but I've just picked out a few, particularly as we are in the summer period. A question that's been coming up probably for the last 15 years, if not longer, is plastic bottles and water in plastic bottles in the car, getting hot. Do the chemicals leach out of the bottles and get into the water, and then essentially are they harmful? Whilst small amounts do, they are not harmful, and there's been no research that has proved otherwise. Mobile phones and Wi-Fi, again, radio frequency is too weak to be able to cause cancer by damaging DNA. So that's another myth. Lots of people talk about stress and a time of stress just before and some time before they're diagnosed with cancer, but there again has been no evidence to support this, that stress directly causes it. However, I think probably the time leading up to cancer may be a time when if there is a lot of stress around, we tend to drop those healthy routines, healthy eating, exercise, all of those kinds of things, which help to lower the risk of cancer. And finally, there's been lots in the press about artificial sweeteners. There's artificial sweeteners in lots of food and drink, but they are very unlikely to cause cancer. And as I said earlier, many people think that sugar causes cancer, but actually it's not the sugar. It is the fact that the sugary foods that we eat cause us to put on weight, and it's the weight and it's the fat that makes the hormones and changes the DNA and that causes the cancer. And just thinking about what screening programs are available, some of this might be available to you now or some in the future, but it's always good to know what's happening. And cervical screening, if you're between the ages of 25 and 64, this happens usually every 3 years, but this is moving to every 5 years for those who have a normal smear test, and you'll know that you'll go for your smear test every 3 years currently. And what they're looking for is the human papillomavirus, and there's high risk forms of this, and that's what they're checking for, because this can then lead to, if it's present, can lead to cervical cancer. And so treating it means that it reduces that risk down. And as many of you will be aware, particularly in the younger age group, we're now vaccinating all children from the age of 12 to 13 with the HPV vaccine. Breast screening is available to women around the age of 50. Some people are not called until they're 52. And mammogram x-rays are used for this screening, and you would have a mammogram x-ray every 3 years up until the age of about 70, and then you can still have screening after this age, but you would need to contact the screening unit to make sure that happens. and bowel screening. This has recently been rolled out to the 50 age group, and it's available in Scotland, England and Wales from 50 to 74, and you'll get a pack through the post, and you'll need to send off a poo sample, and you will get the results back within about 2 weeks. And all of these screenings are to find the signs or cancer early, before it's got chance to be more difficult to treat. Remembering family history. If you have a strong family history of cancer in the family, or you have been to a genetic centre and you've been told that you've got an altered gene, then you may well have to have early screening, particularly for breast, colorectal, ovarian and prostate cancer. And this will start much earlier than the standard national screening programmes. Right now, we don't have a screening programme for prostate cancer. This is for many reasons, but mainly because the blood test, the PSA, the prostate specific antigen, is very difficult to interpret. But I think certainly the word on the street is that this is coming, and it will be coming soon. But if you are over 50 and healthy and you're worried about prostate cancer, or you've got a family history, do go and see your GP and have a chat with them. So just as we start to come to the end, just a little case study. And this is Nettie, who's 61, and she has used our Perci Health digital assessment, and identified, as a result of everything that she put into that assessment, her alcohol intake needs to be discussed, and her red meat consumption, her family history of ovarian cancer, and she hasn't had a smear for some time. So she had lots of information about lifestyle support and how to improve some of these things, how to reduce her alcohol intake, her red meat, and then an appointment with a cancer nurse specialist via chat, and to talk about her risk reduction and potentially her family history. And then understanding about what cancer screening is still available. As she's 61 now, she would need one final cervical screen before that finishes at the age of 65. And I'm now going to pass back over to Ruth, and she's going to go through what Perci Health offers in terms of digital assessment.
Thank you, Rachel. Some really, really interesting and quite hard-hitting facts and stats there. I think I'm sort of thinking about my life choices as you were going through that presentation. I'm sure many people listening will be as well. So really, really interesting. Just a few final thoughts from me, and just bringing it back to our great partnership with Santé. If you are a My Santé member, you do get access to Perci via the app. Members obviously get access to the digital risk assessment. You also receive personalised care plans that are tailored to your needs. There's also the specialist cancer nurse chat on there, and obviously expert created content covering everything from risk reduction, treatment, and also supporting people with cancer as well. Do you want to move forward, Rachel? Really, really easy to get started. Very, very simple. All you need to do is open the My Santé app, create your account, and then when you go into the app, you click on the cancer tile to access Perci Health, and then that's it. You're in, and you'll get access to the assessments, the resources, and obviously the specialist nurse chat from day one. Thank you, Rachel.
So I hope I haven't been too, well, maybe I do hope I've been hard-hitting. I hope that I've given you some food for thought. I mean, the top and bottom of it is 40% of cancers are preventable. And hopefully I've given you some ideas of what you can do in order to make those changes, should you need to. Early detection is critical. Screening is important. If you are worried about a sign and symptom even if you've had a recent screen, always go back to your GP to talk to them about it. It's better that you go to do that than leave something, because 9 out of 10 symptoms will be absolutely nothing at all, but always get them checked. Common myths persist. There are many of them out there. Always check them with reliable sources. Hopefully I've given you some indication of some of the truths, and do feel free to ask me if there's anything else that's come up for you. And personalised support is available through our digital assessment and the My Santé app, as Ruth has mentioned. And do speak to your employer and really get curious about what they offer. Thank you.
Thank you both very much. That was really, really engaging. I really appreciate it, and some very interesting stats. And you've brought up, obviously, getting in touch. We've had a couple of questions come in, which I've been monitoring, so apologies if you saw my eyes flick across a few times. A couple of questions. Rachel, you'd probably be the best person to answer this one. Somebody's reached out and just queried as to why specifically breast cancer screening starts at the age of 50.
That's a really good question. Sorry, Jenna.
No.
It starts at 50 for most people, because our breasts are very dense when we're younger, because we've got the natural hormones, our periods come and all of that. And when those are there, it means that seeing through a mammogram X-ray means that the breasts are really, really hard to see any change. But as we reach our menopause, the average age is about 51, but sometimes a bit earlier, sometimes it's a bit later. That's why the breast screening program starts then. And also, if you remember, most people are diagnosed with breast cancer over the age of 50, 80%. So with any screening program, it's going to be what catches the majority of diagnoses. Having said that, we all know people who've been diagnosed at a young age. And whilst it's less common, it does happen. And we all need to be breast aware and checking and reporting if we're worried about something.
Yeah, brilliant. Great advice. And also, nice to just kind of point out and highlight it as well. We've got, again, just a general question, but I know you touched on it. I have a family history of cancers. Where do I start to even get checked out?
Okay, so the place to start would be to get as much information as you can about the ages and the types of cancer. So the ages of diagnosis and the types of cancer that have been found. And you can look at it from your dad's side, if you know what that is, and from your mum's side, and just separate them out, because you don't add them together and get double trouble, if that makes sense. And then go armed with that to your GP and have a chat with them, and then they will follow a process which has been set out, and will, if they feel, refer you to a breast clinic, which or the appropriate clinic, where they will work out your risk, or to a genetic centre where they will be able to talk to you more in terms of genetic counselling and whether you might need to be tested for any of the cancers that might be relevant.
Fabulous. Just some comments have come through. Thank you. Really engaging webinar. Where can I see follow-up? So essentially what we're going to be doing is post Lunch and Learn. This will be shared directly to our Santé group YouTube page, but also if anyone who wants to reach out, we will have registrations anyway for those who couldn't attend today, and we will be sharing those links out directly to you via email, and additional other clips will be shared on social media. But if you are welcome to introductions, please send any contact information to me and I will share with the Perci team. Any final thoughts, ladies, before we officially sign off?
Just make sure that you eat everything in moderation. That's my top tip.
I think just to say thank you, Jenna, for inviting us along to the webinar. And I think hopefully, having these types of webinars and these types of conversations really brings out that conversation around cancer, because I know it's a difficult complex topic. So, and I think some of those, myth busting and facts and figures that Rachel shared hopefully brings the conversation to the forefront. So, look, if anybody wants to get in touch with the Perci team, we're here to support.
Yeah, absolutely. I think that's a fantastic way to end. So I will just second that, absolutely. And we look forward to obviously more engaging conversations moving forward, and anything that comes through, I'll definitely be sharing it over to you guys. But thank you again from Santé Group and Perci for joining us today for our Lunch and Learn. Take care, everyone.
Jenna.
Thanks, everyone.
Bye.